VolparaAnalytics is a content-rich software application that affords us as end users, whether it's our physicians or our technologists or our administrators, access to data that's acquired during the imaging process.
VolparaAnalytics is a tool which tracks our population's technical factors to do with Volpara. It tracks the breast density. It also tracks the number of studies, number of distinct patients, and number of images. Before VolparaAnalytics, I had no access to this type of data, no way to track breast density in our population.
Through visibility that Volpara has given us, we've actually seen that there is population management differences. As a result, as an administrator, we determined the need for an additional ultrasound machine at one location versus the other because the software results are dictating to us that we have higher population of dense breasts in one location versus the other.
I'm really excited about using the analytics part of our Volpara. Having this detailed information regarding our patient base to know where their breast density lies as far as their age, our population, will give us an idea of how many ultrasound screenings, how many more MRIs we may need to provide for our patients. There's nothing out there that can tell me this information.
Having VolparaAnalytics as part of our toolbox will enable us to see where we have gaps in quality and where we have inconsistencies in application of compression force and positioning.
The real data that I'm getting in the VolparaAnalytics reports gives me an opportunity to show the technologists that there are ways to make an improvement. That I can say that, you know, if you're in room 1, you're using this much compression. And then if you're going to room 2, you're using this much compression.
Good uniform compression of the breast is essential to having the best mammogram. So if we can manage the technologists so that they understand what good uniform compression is and they get that feedback, we not only have a better quality mammogram, but we're also managing dose for that patient. With analytics, we have the benefit of having patient-specific dose for each mammogram that we perform. We can actually look at systems operations, and we can look at the optimal functioning of a unit. Being alerted to subtle changes in an individual mammography acquisition unit before we see a problem in a clinical image is a great advantage.
I think the true benefit of Volpara will actually be born into the future. In a year or so from now, I'm confident that we'll be able to sit down with our insurance carriers and we will be able to justifiably defend the need for additional imaging services based on the analysis of a computer program.
I've never seen anything before that can do this. And after being in the field of mammography for over 40 years, this is a really valuable tool.